Thank you for joining. I am Sheila Chelangat. The 30 minutes of this broadcast begins now. We begin where there are fears over the surge in cases of diabetes amongst children and young people in the country. The high cost of treatment is said to make the situation worse, further derailing efforts in fighting the disease. Elizabeth Atieno begins this bulletin for us.
In Kenya, a glaring statistic reveals that approximately 6,500 children and young people under the age of 20 are living with type 1 diabetes. In 2024 alone, about 570 children in this age group succumbed to the disease, while an estimated 1,380 were newly diagnosed.
The numbers that we presented in the report, and I think the numbers that we see in terms of the rising prevalence of type 1 diabetes, I think we also need to see that with the lens of this might be heavily underestimated, because we do know that so many children and young people today, they go either undiagnosed or misdiagnosed.
Health stakeholders have raised concerns over the shortage of insulin among those living with diabetes, especially in Kenya, following the high cost of treatment. Kenya is said to report high level of out-of-pocket payment for insulin.
There's also issues around supply chains. There's also issues around cold chain, which again, for insulin particularly, if you have files, that creates challenges in being able to reach people actually with some of the products, not only in urban centers, but again, particularly in rural communities and that last mile distribution.
Out of the 113 low and middle income countries, Kenya has been ranked the 44th in the prevalence of type 1 diabetes among children under the age of 20.
Even though these initiatives are operating, even though they supply all of these very critical, important products, they are donation-based and they do rely on donations. And when I say that in Kenya, we have had, like for a child and also changing diabetes in children, providing this critical support, it also provides a bit of a fragile system, right? Where at any point support could be withdrawn.
It is in no doubt that we are in the era of unprecedented demand for diabetes care products, with the number of people living with type 1 diabetes projected to nearly double in the next 16 years, reaching 16.4 million globally by 2040.
Something that is very important is for countries to list insulins and commodities within their national essential medicines list to be able to make the case for reimbursement, but also for procurement. And this is the case in Kenya, where this has been implemented.
In 2024, approximately 9.1 million people were living with type 1 diabetes, including 1.8 million children and young people. The numbers are sobering, the voices are real, and the urgency up too is undeniable. Elizabeth Atieno, TV 47.
Elizabeth Atieno. Moving on.